How to heal a meniscus tear. The knee is protected by a C-shaped cartilaginous disc, the meniscus. It cushions the outer and inner edges of the knee, balancing weight across the knee. An injury or torn in the meniscus can hamper normal performance of the knee and can cause pain, swelling and stiffness. If left untreated, a torn meniscus can lead to knee instability, an inability to move your knee normally, and persistent knee pain. 1. To heal a meniscus tear through medication, self-care, exercise, or a combination of the three, start with step 1 below. Use price therapy. You can quicken your healing process by using price therapy: a protection, rest, immobilize, compression, and elevation. 2. The P, protection, means it is necessary to avoid further damage to the affected area that can lead to more serious complications. The following measures must be avoided: heat. Exposure to heat causes dilation of blood vessels that can generate more episodes of bleeding. Thus hot baths, saunas, heat packs, or even contact with hot environments must be avoided. Further movement. Limitations of certain activities must be considered to avoid further injury to the involved area. Massage. Any pressure placed on the affected area may lead to more damage. Rest. Avoidance of activities is usually recommended during the first 24 to 72 hours of injury. Adequate breaks or rest should be promoted to ensure proper healing and prevent further damage to the surrounding muscles and tissues of the affected area. Some exercises may be helpful after the initial 72 hours have passed. Those will be discussed below. Ideally, they would be conducted under the supervision of a physical therapist. Apart from these, it's best to stay off it. Immobilize your knee. Splint and bandages may be placed on the involved area to stabilize it and prevent unnecessary movements that can further damage the tissues and muscles. Talk to your doctor about what methods of immobilization are best for your case. Use compression. During the first 24 to 72 hours after the injury, ice wrapped in a moist towel should be placed over the injured area for 15 to 20 minutes at a time with 2 to 3 hour intervals in between. Follow these guidelines to be sure that you don't cause tissue damage, a result of freezing skin. Exposure to cold temperature causes the blood vessels to narrow, thus decreasing flow of blood and swelling in the affected area. Compression also aids in stimulating the flow of lymph fluid, which carries important nutrients to the damaged tissues surrounding the injury. Lymph fluid also removes waste from cells and body tissues, which is an important function during the tissue regeneration process. Elevate your knee. Continuous elevation of the injured area must be given much importance to ensure proper blood circulation and healing of the involved area. Keeping it elevated will reduce blood flow, thus reducing swelling. When sitting or lying down, prop your knee up with a few pillows. It's best to lay down, but you may also sit so long as your pelvis is beneath your knee. Take pain medications. Over-the-counter drugs that are used to relieve pain can be incredibly helpful. However, before you start on medication, know that it's best to discuss treatment with your doctor. He or she will likely know which route is best for you or be able to prescribe you a stronger medication. If pain gets severe and swelling is present, consider taking Celebrex, 400 mg on the first dose and 200 mg twice daily as needed for subsequent doses. If you are lucky enough to be without swelling and only experiencing mild pain, try 650 to 1000 mg of Tylenol every 4 to 6 hours as needed. If you drink alcohol, take precaution. Certain medications react negatively with alcohol. Consult your doctor for advice if this applies to you. Take NSAIDs. These are oral nonsteroidal anti-inflammatory drugs, NSAIDs. However, they should not be taken during the first 48 hours of injury because they reduce inflammation, which is considered one of the body trademark's compensatory mechanisms. In other words, intake of this drug during this period may interrupt healing. 5 examples are ibuprofen, aspirin, and naproxen. All of these work by blocking certain body chemicals that ground the progress of inflammation in the involved area. Try physical therapy. We'll discuss physical therapy exercises in the next section. For the meantime, know that starting physical therapy can be an incredibly effective way of shortening the healing process. Consult your doctor first before starting therapy. He or she will know what's appropriate for you. Exercises should only be done under the guidance of a therapist so that you will do the exercises correctly and not worsen the situation. Consider surgery. This should only be considered if other means fall short. Knee surgery can be performed to patch up and join injured tissues of the meniscus to restore its normal functioning. The surgery is called total meniscectomy, which is a surgery that removes the entire meniscus. Again, your doctor will know if this is a viable option. Find a licensed physical therapist. Physical therapy involves various exercises that can help you overcome your condition. Starting an exercise regimen with a professional can help you regain strength of the meniscus and preserve its optimal performance. The first 5 exercises discussed below can be done immediately and be followed by the rest once the pain felt in the knee has minimized. 6. These exercises involving movements of the muscles promote better circulation of blood and distribution of oxygen to the affected area. Sufficient supply of oxygen maintains cellular integrity, function, and aids in the speedy repair of damaged tissues. Do the passive knee extension. This is often suggested if patients are not capable of extending the knee completely. Here's how to do this exercise. Once in a lying position, put a rolled up towel beneath the heel of the damaged leg to raise it at least 6 inches from the floor. Rest the muscles of the leg for 2 minutes and allow gravity to gradually straighten the knee. Repeat the step for 3 times and execute the exercise for as many repetitions as desired. Try the heel slide. Once the pain has started to subside, you can try the heel slide. Here's how. Assuming a sitting position, extend your legs in front of you and gradually slide the heel of the foot on the injured side toward the buttocks. Return to the starting position and repeat the exercise for up to 15 sets. Try the standing calf stretch. In a standing position, place your hands on the wall at eye level. Place the injured leg behind you with your heel grounded on the floor while the other leg is positioned forward with your knee bent. As the back foot is slightly turned inward, slowly lean towards the wall until a stretch is felt in the calf. Keep the position for 15 to 30 seconds and return to the initial pose. This exercise can be repeated several times a day. Do hamstring stretches on the wall. Lying on the ground with your buttocks near the doorway, extend the uninjured leg through the doorway. Then, elevate the injured leg and rest it against the wall beside the door frame. Maintain the position until a stretch is felt at the back of the thigh and repeat it 3 times. Feel free to hold this stretch for as long as feels good. This stretch is especially nice as the doorway takes the pressure off your legs to hold the stretch and the pressure off your arms to hold your leg. Try the straight leg raise. Lie flat on the floor with your legs straight in front of you. Bend the knee of the uninjured leg slightly and position the same foot flat on the floor. Stiffen the thigh muscles of the injured leg and raise it about 8 inches from the ground.